Hi, my name is Michelle Plyler, and I'm a certified nurse midwife here at County OBGYN. During the first week of October, we're celebrating National Nurse Midwifery Week. I would like to talk to you about a condition from which many women suffer in silence: postpartum depression. It's time to break the silence. Postpartum depression can affect any woman after having a baby, and in fact, about 1 out of every 7 women with newborns experience postpartum depression. Postpartum depression does not discriminate. It can happen regardless of a woman's age, race, ethnicity, economic status, or despite if it's her first, second, or third child. Having a baby changes your body and your life in ways that are hard to predict. Feeling sad, moody, or tired are common after childbirth. These baby blues affect about 80% of new mothers during the first week or so after delivery. Postpartum depression is different. The symptoms of postpartum depression are not mild like the baby blues, and they last much longer. Postpartum depression can interfere with your ability to take care of yourself and your family. While postpartum depression commonly begins about 4 to 6 weeks postpartum, it can happen at any point in the first year after the baby is born. Some women are at greater risk for postpartum depression. Risk factors include depression during pregnancy or after a previous pregnancy, history of depression, anxiety, or bipolar disorder at another point in your life, a stressful life event during pregnancy or shortly after birth, medical complications during the pregnancy, birth, or after the delivery, or having a baby with medical problems. A lack of strong emotional support can also be a factor. The symptoms of postpartum depression are not the same for every woman. The most common symptoms are feeling sad, hopeless, empty, overwhelmed, crying more often than usual, worrying or feeling overly anxious, feeling moody, irritable, restless, oversleeping, or even not being able to sleep when your baby is asleep, having trouble concentrating or making decisions, frequent feelings of anger or rage, losing interest in activities that you usually would find enjoyable, eating too much or eating too little, avoiding your family and friends, having trouble bonding with your baby, or persistently doubting your ability to take care of your baby. And a symptom that rarely occurs, thinking about harming oneself or the baby. If at any time you experience symptoms which you feel put you or your baby in danger, you should call 211 or 911 and seek emergency assistance. Many times, the pressure of wanting to be the perfect mom can keep us from sharing feelings of sadness and anxiety. Postpartum depression is not a negative reflection of our parenting skills, and it's biological in most cases. It also happens to be one of the most common complications of childbirth. The good news is that there's help for postpartum depression. Seeing a therapist or starting an antidepressant are both effective treatments. And there are antidepressants such as Zoloft, which are safe to use while breastfeeding. I encourage you to have an open and honest conversation with one of our midwives or doctors while you're pregnant and or after delivery if you have any concerns about postpartum depression. Together we can break the silence.